Hi, I'm Jason Moore. I'm director of the Institute for Biomedical Informatics here at Penn Medicine. Today, I'm going to provide a brief introduction to some of the clinical data and analytics resources available to our community. The top of this slide is our patient population. Our patient's data is deposited in our Penn chart electronic health record, powered by Epic. We are a learning health system and are very much interested in using our patient data to improve the healthcare process and the health of our patients. There are a number of ways in which we do that. First, we collaborate with Epic through their Epic Cosmos database to deposit some of this data, along with data from other institutions from around the world. This allows us to perform queries and look for patterns that may inform healthcare at Penn Medicine. Further, we have developed a new data warehouse called Penn GMP, which stands for Genotype and Phenotype. We take some of the clinical data in our Epic Clarity database component of Penn chart, and we map that data to a common data model called OMOP. This is important because this allows us to then collaborate with other institutions around the world that are also mapping their data to the OMOP common data model. This helps ensure that we're studying the same thing and allows replication experiments through consortia such as the Odyssey Consortium. PennGMP is designed to allow investigators to query the clinical data without IRB approval in a self-service manner. Once a cohort of patients is identified, then the data can be requested for study. We have also developed a new type of database called a graph database, which takes the clinical data and maps it onto an ontology, which then allows us to more thoroughly investigate the relationships of the data, which also allows a deeper understanding of the data. Penn Turbo is also self-service and allows natural language queries of the data. Penn Turbo is connected to our Penn AI software, which is designed for automating machine learning to make it easy for anybody to do machine learning on our clinical data. We have also developed a specialized data warehouse specifically for studying COVID-19. This database uses a database called I2B2, which allows us to plug into the ACT network through the CTSA program, allows us to query data at other sites around the world through Shrine, and has allowed us to participate in a COVID-19 data analysis consortium called 4CE. At the top right of this slide is the Penn Medicine Biobank. Some of our patients provide blood samples or tissue samples that are stored in the biobank, and some of those are used for genetic and genomic measurements, for example. Those data can then be integrated with the clinical data in our data warehouse to allow research studies asking genetic and genomic questions of health outcomes. We are also centralizing other public data sources, such as genetic and clinical data from the UK Biobank, to make it easy for our community to access those data for research purposes. If you are interested in using any of these resources, you can contact the Information Services Data Analytics Center, which is really focused more on operations in the health system, or the Institute for Biomedical Informatics Clinical Research Informatics Core, the CIC, which is there to help investigators do research with clinical data. I would like to acknowledge Penn Medicine for its many investments in our health IT infrastructure and our biomedical informatics resources and expertise. I'd like to specifically recognize Information Services for all of its amazing work to put in place many of these health information technology resources. I'd like to acknowledge the Institute for Biomedical Informatics, who helped develop Penn Turbo and Penn AI, and the I2B2 data warehouse. I'd also like to recognize the many faculty, staff, students, clinicians, and others, administrative personnel, that have played a very central role in building and coordinating all of these resources. If you have high level questions, we'd love to hear from you. You can reach out to us. You can contact Jim Beinlich, our Vice President and Chief Data Information Officer. You can contact me as Director of the Institute for Biomedical Informatics. And you can contact Danielle Mowry, our Chief Research Information Officer and Director of the Clinical Research Informatics Core. Thank you.